Hi, this is Dr. Kaan of the ACL Academy, and today I'm going to touch on hamstring progressions and hamstring strengthening and how that is also a vital part of the ACL recovery process. Here at the ACL Academy, you see us focus really big part of our recovery on quad function, quad firing, getting that quad strength back after ACL recovery, because this is where people take the biggest hit. But some of us who have replaced our ACL with the hamstring tendon, there is an area where we need to get going and start working and get strong again, because this is an area where weakness can linger for people, specifically for females. It's been studied that sometimes hamstring strength does not come back for a year or longer after ACL surgery. So today I'm going to touch on some progressions to get you started and going. Guys, before I get further into that, if you found some value out of this channel, please like the video. Please subscribe to our channel. If you have questions, comments, drop them below. We get to basically every single one. And of course, more importantly, share with fellow ACLers that can benefit from these tips and education. We put out a new video each and every week here. So hamstring progression, right? So for those of you who had a hamstring graft, they basically steal a piece of that hamstring tendon and they use that to replace your ACL with. Well, guess what? We are robbing a piece of normal, healthy tissue. And because we are doing that, that takes time to heal. So that area needs to scar back down, and then we need to start getting strong again. So in these cases, for anybody with a hamstring tendon graft, we do have to monitor this, because early on we're working on getting the knee straight. So we are stretching that area, right? When we straighten the knee, we are stretching the back side of that. So it can be uncomfortable for people, and this is okay as long as pain levels are low. Now, when it comes to strengthening, well, we're going to load up and we're going to work that hamstring right away. No, we have to take time with it. We have to start with some basics and then build back up. So here, what we like to start with, especially somebody who's early on hamstring tendon graft, is isometrics. So isometrics is basically a contraction where the muscle does, the joint itself does not move. So we're contracting our muscle without any movement at all. So we're not doing any lengthening or shortening. And this is a good way to start building back up. If you are in this process, you know quad isometrics, also known as a quad set, right? That's the first exercise that we do with the quad. So similar to that, we do it on the hamstring side. So a couple ways that you can do this. Basically, I like to start off in more of a laying on your back position here. And the beauty of this is you can start working at different angles, right? So if I'm laying here and my right leg is my involved leg, okay? So if I bend it slightly, I'm going to put my knee at a little bit of bending or flexion. And the way that I'm going to list this contraction is I'm going to push my heel down into the mat, right? So I'm going to push down. If the mat wasn't there, I'd be bending my leg. So I'm looking to push into more flexion, and as soon as I do that, I'm going to feel my hamstrings start to contract. Okay, similar to a quad set, this is a hamstring set, and we will do anywhere from 3 to 5 second holds and then relax. 3 to 5 second hold, pushing down to the table, and then relax. And what I can do now is bend my leg a little bit more and work another range. So I'll work this range, 3 to 5 seconds, relax, push down, 1, 2, 3, and then relax. Okay, and as I get comfortable with that, I can work further up the range. Again, looking to do 3 to 5 second holds, and you could work sets of 5, 10, and then work through the flexion range, pull it up some more. And then same thing here. It also will depend on how much flexion range you have after surgery. So these are areas that I would work in. Once that gets comfortable and you can really push in with these hamstring sets and not too much pain or any at all, we can start working through some motion. So some table exercises I like to do. One is a long lever bridge. So when you're doing a bridge with your knees further up, you're going to get more glute contraction. If we want to do more hamstring, we're going to work out. So usually with hamstring stuff, I'll get the knees 10 to 15 degrees or so bent, and you're going to bridge up in this position, okay? and you don't have to hold. You just push in, bridge up, you'll get a contraction, back down. And you can work your sets that way. Once you get comfortable with that, you could do a single leg bridge, then back down, single leg bridge, back down, and then work your sets there as well. Now, to start challenging more in isolation, we're going to look to do a curl. So here is where I'd have you flip back over. I'm going to show you on my left side. It'll just be easier here. And in the beginning, you're going to work just against gravity, where you're pulling up and working now through the range of motion. Okay, as this gets comfortable, you're going to add an ankle weight to this. So this is one variation of doing it. Again, you would work your working sets, and as you feel good with just gravity, you'll add an ankle weight. So you'll start adding resistance and building up that way. Another way to work in isolation is you would do it standing. So if you're standing, let me just show you here so you can actually see, but same concept. Instead of laying on your stomach, you will work your sets standing. Again, you'd start working against gravity. You can take up as much range as you can get the knee to bend, and then once that feels comfortable, you're going to add resistance that way. So for me, I like to challenge this type of stuff early on. So we'll do isometrics early. You'll see me do some of the laying down stuff, the long lever bridge variations as well. Once that feels comfortable, maybe 4 or 5 weeks in, we'll also start adding isolation work. So hamstring curls prone, laying on your stomach, as well as standing. And that feels comfortable against gravity. We start to build and add weight. And once you're moving 5, 6, 7 pounds comfortably, we can transition you into a gym machine where you do a seated curl or laying on your stomach, a prone curl. So same variation, but now you can move more weight. And then you'd build strength like that appropriately. So that's isolation exercises. Of course, just like when we talk about quad work, we work the quads in isolation on a leg extension machine, but we also do different variations like step ups, lunges, squats to work that muscle. Same thing with hamstrings. You want to work in isolation with your curls, right? Prone curls or your seated curls, but we also add in some more functional type stuff or compound movements such as deadlifts, such as single leg RDLs, right? A larger step up, right? So we can get a little bit more posterior activation. So those are the ways that I would challenge it and work it that way. And then even towards the end or towards, as we get further along the care, as we get some real strength there, we love to add in a Nordic type exercise. So that's a good lengthening type contraction. But again, this will be further down the road here. Start with the basics. You got a hamstring graft. Make sure you're doing those isometrics early. Then you can move through movement. So just against gravity, that's laying on your stomach, doing some leg curls or standing leg curls. Once that feels good, add some ankle weight. Once the ankle weight builds up to a certain amount, then we transition to a gym where you're doing some seated or prone or laying on your stomach, active strengthening, progressive strengthening work. And then, of course, working your compound movements, your deadlifts, your RDLs, your good mornings, exercises like that, where you're also going to challenge your hamstring in different ways. Hope that makes sense, guys. If you have some questions, drop them below. If you found some value here, please like the video. Please subscribe to our channel. Of course, more importantly, share with a fellow ACLer that can benefit from these tips and education. We put out a video every single week. This is Dr. Kaan signing off.